Leading from the front, Zimbabwe's legislators campaigning for HIV testing and circumcision. On the Millennium Development Goals scorecard, the country has scored the highest in reducing HIV and AIDS incidents, halving prevalence to 15%. Zimbabweans say they are proud of the achievements.
Everybody now is very is knowing the situation of HIV and everything.
In Epworth, where I come from, the number of clinics has increased dramatically over the last few years. We no longer have to walk long distances to access treatment.
It's thanks in part to an early initiative, the AIDS levy, introduced in 1999. All working Zimbabweans were forced to pay 3% of their income into the levy. The contributions kept at least 90,000 people alive with ARVs when international funds were dwindling. On the other health fronts, though, it's been a mixed bag. While child mortality has been coming down, it's unlikely to reach the 1/3 target that's been aimed for. A 2012 government MGG progress report also states that maternal deaths have increased due to lower rates of attended births and the higher costs of health care. She says, it's not as bad as it used to be, though. Now we have access to medicine that prevents HIV infections for rape survivors, as well as medicines that prevent mother-to-child HIV transmissions. Our health is better than it used to be. But new threats are arising, warns a UNAIDS director for Southern Africa in an interview conducted earlier this year.
The only place where we're still lagging behind is really new infections, especially among young people. All countries have had a reduction in the AIDS, in new infections. But among the new infections that are coming up is among young people, especially young women.
As Zimbabwe looks beyond the MDGs, it's trying to use this victory in rebuilding a health system that was once the envy of the continent. Shingai Nyoka, SABC News, Harare, Zimbabwe.